Sports injuries. Fractures. The aims of this educast are to explain the term fracture and to give examples of fractures. When injuries occur, such as a fracture, there are a number of signs and symptoms that help you identify the injury. Signs are things that you can see, feel, hear or smell. A symptom is something what the patient can feel. A fracture is a broken or a cracked bone. Signs to look out for could be hearing the noise of the break, or you could possibly see a misshapen bone in the patient. The symptoms of a fracture will be that the patient may not be able to move the limb, with very intense localized pain and swelling at the injured area. A fracture happens when large stresses are placed on a bone. This could be through a twist or through forceful contact from another object. There are various types of fracture. The most common is a simple or closed fracture. This is where the bone is broken, but the skin is unbroken. There's a compound or open fracture. The bone is broken and it comes through the skin, so you can actually see the bone breaking through the skin and you'll be able to identify the broken bone. There are other types of fractures. A stress fracture, and this occurs through repeated force. So a marathon runner who does a lot of training could get stress fractures in the shin, and this occurs from the repeated stress of the leg hitting the road, and that stress causes breaks and fractures in the shin, a stress fracture. A greenstick fracture is a small crack in the bone. Children usually suffer from this type of break, and it's where the crack does not go from one side to the other. It doesn't completely break through the bone, it's just a very small crack. And a spiral fracture occurs when the bone gets a very severe twist. So in summary, a fracture is a break or a crack in a bone.